We'll quickly look at the complications of diabetes mellitus. Now, note that what? Complications are not symptoms. Complications is when the disease condition has gone out of the box. The disease condition is now after your life. That's what is known as what? Complications. So this diabetes mellitus has complication. We've spoken about the type 1, which is due to what? No insulin production or low insulin production. Then we also spoke about type 2. Type 2 is more of like there's insulin production, but there's resistance to insulin. Okay? So either one of them, there's no glucose breakdown. So you have what? Hyperglycemia. Okay? So what are the complications of diabetes mellitus? So the complications of diabetes mellitus are subdivided into what? Short term or acute. So short term or anything you say acute is something that just started all of a sudden. They also have long term complications, also known as what? Chronic complications. Okay. For the short term complications now, we have things like what? Diabetic ketoacidosis. We have what? Hyperosmolar hyperglycemic states. We have hypoglycemia. We have lactic acidosis. All right. That's it for short term complication. Then for long term complications, we have things like what? Microvascular complications like diabetic retinopathy, diabetic nephropathy, diabetic neuropathy. So, like diabetic retinopathy, now you're having complications of the eye simply because what? There's diabetes. All right. Then we also have macrovascular complications like what? Cerebrovascular disease, coronary artery disease, peripheral artery disease. Okay. So that's it for the complications of diabetes mellitus. God's willing, I'll be taking time to talk about each of these disease conditions. So if you want to know more on any one of them, you simply ask me and I'll drop you the link I made on it.